Thank you all for coming. I wish I could have spoken to all of you this morning and greeted all of you, but we have a good problem in that there's a lot of people here today, and that's so exciting. So I just want to thank you for coming and making time. I know you're all very busy, and this is just really awesome. I'm Allison Trainer. I'm the Suicide Prevention Director for the Department of Health, and I'm also the Department of Health Liaison to the Suicide Prevention Coalition. We have a packed agenda, as you see, so I'm just going to start speaking now to ensure we end on time. I also just want to let you know that there are refreshments here, as you see. The restrooms across the foyer on the right side of the hall. And if you need to, if you need to stand up, if you need to grab a snack, whatever you need to do, please do so. Also, we're going to cover some really difficult material, possibly. It's a challenging topic, suicide, and sometimes folks can get triggered. If there's anything that distresses you, please, I encourage you to step out. But I hope that this is a very uplifting and positive event. But please take care of yourselves, and please just keep that in mind. On the agenda you received, note there has been 2 changes. Our suicide prevention champion, State Health Officer Milan Tufte will be delivering the welcome on behalf of the Governor and First Lady. Also, Mark Lowmurray from Sources of Strength, the CEO and founder and researcher, is also presenting towards the end of the agenda for Sources of Strength alongside Cody Slutton. So I am just going to take the privilege of introducing Milan Tufte. In February of 2017, Governor Burgum appointed Milan Tufte as State Health Officer. She has more than 20 years of experience in health industry and population health management. She has helped organizations improve quality, cost, and access to patient care. Milan holds a bachelor's degree in nursing and a master's in business administration. In addition to overseeing the Department of Health and the State Health Officer implements state laws governing the department with the guidance of the governor and regulations adopted by the State Health Council. As a suicide loss survivor and a compassionate person, Milan has been a great advocate for suicide prevention, and she's really supported suicide prevention efforts across the state. Please join me in welcoming our State Health Officer and suicide prevention champion, Milan Tufte.
Good morning. Thank you for all being here. It's with gratitude that I welcome you on behalf of the Governor and First Lady. You may know that the First Lady was invited to be a speaker as a panelist at the White House discussion around opioids. So I know that they would have enjoyed being here with you today and do send their regards. I welcome this group of champions, survivors, and volunteers. The fact that over 130 of you registered for this inaugural event is proof of your passion and dedication to this critical issue. There's a lot of work to do. It's a big task, but we know you're up to it. Suicide is a preventable public health issue. It's the number 2 leading cause of death in North Dakota youth. It's the 10th leading cause of death across all age groups. It's true when you turn on the news, the opioid epidemic is a nationwide crisis, yet suicide took twice as many lives as opioids in 2015. Like the disease of addiction, shame and stigma silences and prevents those who suffer from getting the help they need. It's personal. As Allison said, I'm a survivor. My father passed in 2013 after a battle with Alzheimer's. And so I know that people hurt from this, and your work is important. Many people think suicide cannot be prevented, but research shows that most people have suicidal thoughts, that have suicidal thoughts and behaviors, get help and they recover. Recovery is possible. Thank you again for the work that you do, and thank you for the connections that will be made today, the ideas that will be shared, and the positive impact that will result when a passionate group of people get together and make a difference. Have a great conference. Thank you, Allison.
Thank you, Milan, for that lovely introduction to this conference. Again, I just want to thank you all for being here. I want to acknowledge a few folks. First and foremost, the State Health Officer, Milan Tufte, who's been a true champion and has worked alongside the Governor and First Lady in working to prevent substance use, prevent suicide. I want to share a special thank you to Blue Cross Blue Shield of North Dakota for their sponsorship. Without them, this would not be possible. They are providing much of the food and refreshments and just really help pull this together. I want to thank Cadoba for their donation of food items, for part of the food items. And a special thank you to the legislators that also advocate for suicide and behavioral health prevention. I want to thank our speakers and the Suicide Prevention Coalition Planning Committee. If the Coalition Executive Planning Committee could please stand. Please, if you have any questions. If you have any questions or concerns or ideas for future events like this, please, those are the folks that you might want to talk to. The Suicide Prevention Coalition is a group of survivors, suicide prevention champions, and volunteers from across North Dakota who work to prevent suicide and support suicide survivors. This powerful event would not be possible without their work and dedication. Also note that the Suicide Prevention Coalition developed a state plan that you all have in the spiral binding. As you listen to stories and information as important stakeholders and folks that are doing this work or just advocating for suicide prevention and letting people know that there is hope, please just take note of that state plan and the action steps at the end. There's also a one-page sort of brief document that also goes through the state plan goal and objectives that you'll find in your packet. You'll also find a half sheet of paper that asks for your contact information and any topics that you might be interested in sharing and leading in the future. We're looking at really moving forward that state plan, turning it into action, but we can't do it alone. And so we're just really interested in getting new members, getting new energy, and working together to end suicide. Finally, I just want to thank you all for taking this first step to ending suicide. Again, I'd just like to thank Blue Cross Blue Shield for the coffee, breakfast, snacks that we have. The restrooms, of course, are across the way. If you came in after I started speaking, they're across the foyer on the right side of the hall. Please ask executive members any questions that you have. We have a packed agenda, so please, I just would like you to take care of yourselves, use the restroom, grab a snack, do as you wish as we move forward, because we will be taking few breaks. Also note that the speakers will be introducing themselves. And again, this is a difficult subject matter. So please step out if anything, if you just feel like it. So why are we here? As Milan mentioned, suicide is an epidemic in the United States. It's the second leading cause of death for youth and adults in their early 20s. It's increasing in rural communities and in North Dakota. And it is the second leading, it takes twice as many lives as the opioid epidemic on average. This is a graph that just shows that overall the trend is increasing since the year 2000. The effects of suicide are many. It costs our nation $51 billion annually in reported cases alone, and for every suicide death, there's 25 attempts and many left behind. It cuts across all social and demographic classes, but it impacts Native Americans, veterans, and working-age males most acutely. One suicide loss survivor said that it's accompanied by shame, making it unlike any other loss. Today we're going to be talking about different risk factors for specific to different groups. Some of the risk factors that I see covered for rural communities in the literature is socioeconomic factors like access to insurance or care, behavioral health conditions, particularly alcohol and depression and anxiety, and borderline personality disorder, and access to lethal means such as firearms or medication. In the United States, over 50% of suicides are, firearms are used in over 50% of suicide deaths. And if we were to look at attempts, medication and cutting make up most of those attempts. But only 1% of suicide attempts by medication and cutting result in death. So experts are encouraging folks that work in suicide prevention to put time and distance between people who are at risk of suicide and firearms. The good news is there is hope. We're all here together. We're learning. We're going to learn about best practices in suicide prevention. We're going to learn from the expertise of survivors and individuals who've been working on the front lines of this crisis. And most people who suffer from suicidal thoughts and even suicidal attempts actually get help and recover. Today, we can start this effort together. We can share our voices and our experiences. We can take action. Please sign up for the coalition on the half sheet card that you have in your packets. Please sign up for any working groups that you'd be interested in. Just write down different topics or specific strategies that you're interested in from the plan on your half sheet of paper, if you so choose. Now, I would like to introduce Samantha Brewers from the American Foundation for Suicide Prevention, who's leading the efforts with Out of the Darkness Walks and research and many other activities that she'll share with you. Thank you.
Hello, everyone. As she said, I'm Samantha Brewers, Area Director for the American Foundation for Suicide Prevention. I look over the Dakotas. And it's incredible to see so many suicide prevention advocates in one space. So this is just an incredible group, and I'm glad that we can collaborate today. I just was asked to share a few words about AFSP and our work and what we do. So we are the American Foundation for Suicide Prevention. We're a voluntary health organization, and it's our mission to save lives and bring hope to people who have been affected by suicide. We're active in many different ways. On the national level, we're the #1 funder of mental health research, because we know that research is important. The more that we know about suicide, the brain, the more that we can develop to help more people. We take that research and create evidence-based programming that we use here in North Dakota. Talk Saves Lives, More Than Sad, that's just a few of the programs that we have throughout the state. We're also very active in advocacy. So we encourage our field advocates to get involved, share their stories with our legislative leaders, and take action about laws that have to do with mental health. We're also very active in outreach for lost survivors, so people who have lost loved ones to suicide. We want them to know that they are not alone and that there are resources for them to help them grieve and know that they are supported. We have the Survivor Outreach Program, which are trained volunteers, but they've also been through a loss, and they connect with other loss after a loss to get them connected to resources. This is pretty much been in the Fargo area, but we're getting it up and going to be across the state, and we're getting the Bismarck group up and going. We also have International Survivors of Suicide Loss Day, which is phenomenal that they do a great job here in Bismarck, as well as there's other trainings to help people facilitate support groups, as well as do save the date in June. We do have clinician training to help clinicians help people who have lost loved ones a little bit better. So that is June 4th and 5th. There will also be a workshop for lost survivors, and that is complimentary for the workshop. We're able to do all of these incredible programs because of the Out of the Darkness walks. I see a lot of friendly faces here, and I've seen you at Out of the Darkness walks before. So thank you for coming out and walking in support. But because of those walks, we can fund those programs. We have 8 Out of the Darkness walks across the state, and that's just really incredible because we are boots on the ground. We're people who care about suicide prevention, and we're taking action and we're making things happen. So I said I wouldn't talk too long, and I think I'm already talking too long. So I'm from the American Foundation for Suicide Prevention, afsp.org. If you want to learn more, we'd love to get you connected and get you involved in your communities. And thank you for helping us to save lives and bring hope.